When you think about moving a person, whether it's helping them sit up in bed or stand up from a chair, it's so easy to think it's all about brute strength. But it's not. It's actually more like a carefully planned dance, a skilled procedure, a real choreography of care. Today, we're going to break down that choreography because, honestly, mastering these steps is absolutely critical for preventing career-ending injuries for so many caregivers out there.
So let me ask you this. What do you think is one of the biggest but most overlooked dangers in our entire healthcare system? It's probably not what you're thinking, and it's something that happens every single day in countless tiny interactions between caregivers and the people they care for. And the answer is musculoskeletal injury to the caregiver, the person providing the care. What's so insidious about it is just how mundane the causes are. We're talking about things like poor posture, frequent bending, a little too much pushing and pulling. These are the everyday actions that, when you do them incorrectly or just over and over and over again, they lead to really serious harm. This isn't about one big accident. It's about the slow, cumulative strain of caring. But there is a smarter, safer way to do this. And thankfully, it's a philosophy known as PDSP. That stands for Principles for the Safe Displacement of Persons. And really, it's a complete shift in how we think about providing physical care. See, at its very heart, PDSP recognizes that this is not just some mechanical task. The core idea here is that every single physical interaction is built on a relationship. It's an act of care, not a feat of strength. And that means the care shouldn't just be imposed on someone. It should be a real partnership. And that partnership, it's captured perfectly in this one powerful principle. This is the mantra of PDSP, right here. Encourage the person to use their abilities, and by doing that, you minimize the caregiver's effort. It's not about doing things for them, it's about doing things with them. Suddenly, both people become active participants in the move.
So, to put this whole philosophy into action, PDSP uses a really professional, systematic approach. I want you to think of it like a pilot's pre-flight checklist. It's designed to transform a high-risk activity into a controlled, repeatable, and most importantly, safe procedure. And here it is. This is the 7-step roadmap for every single interaction. Notice how it all starts with preparation, long before any movement actually begins. And maybe the most critical step of all is number 2, collecting the data.
Step 2, data collection. This is basically the brain of the whole operation. Before anyone moves an inch, you have to assess the entire situation. And look, this isn't just about the person's physical state. It's about you, the caregiver. You have to ask, do I have the skills for this? It's about the timing, the specific task, the environment, like, is the floor clear? And of course, the equipment. Every safe move begins by asking these exact questions.
Okay, let's make this real. Meet Mark and Matthew. On paper, they look pretty similar, right? Both are 51. But their needs? They are worlds apart. Mark is quadriplegic and needs complete assistance, which almost certainly means mechanical equipment. Matthew, on the other hand, is post-op and just needs a bit of partial assistance. That data collection step immediately tells us that these two situations require completely different plans, different equipment, and different techniques. One size absolutely does not fit all. All right, so once the situation is assessed, it's finally time for the movement itself. And this is where that choreography really comes to life, because it is all about using technique, not just raw muscle. The foundation of this technique is something we call natural movements. I mean, just think about how you get out of bed in the morning. You probably roll to your side, push up with your arms, and swing your legs over, right? PDSP doesn't try to reinvent that process. Instead, it's all about guiding and assisting the person through the movements their body already knows how to do. Now, the level of assistance we provide is dictated entirely by what the person can do. If they're pretty much autonomous, the caregiver's effort should be minimal. For partial assistance, it's slight effort. But, and this is a big one, when complete assistance is needed, that is a crystal clear signal that the caregiver should not be using their own strength. That's when equipment becomes absolutely mandatory. And for you, the caregiver, protecting your own body is just paramount. These rules right here, they're non-negotiable. Keep your back straight and your knees bent. Plant your feet apart for a solid base. Move your feet to avoid twisting your back. And always keep the person close to your center of gravity. This stance is your best defense against getting hurt. And of course, this physical dance is guided by clear communication. We're talking simple, positive instructions. You just tell the person what you're going to do before you do it. Okay, on the count of 3, we're going to stand up.
This makes them a true partner in the movement, not just a passenger.
Now, the choreography isn't over just because the person has been moved. Just as important as the move itself is how you finish the interaction. You have to ensure ongoing safety and comfort.
And this is where the SCORE checklist comes in. It's a super simple acronym you can run through at the end of every interaction just to make sure nothing gets missed. Is the person safe with the call bell in reach? Are they comfortable? Is the room in order? Are they set up for rest? And finally, have you done a final evaluation? This is how you make sure you leave the person in a better, safer state than when you started.
You know, it all comes back to this one simple goal. If you remember just one thing from all of this, let it be the central philosophy of PDSP. Always promote the patient's abilities and minimize the caregiver's efforts. It's a win-win. The patient gains independence and dignity, and the caregiver is protected from harm. It's as simple as that.
And that kind of leaves us with one final thought. This system was designed for healthcare, but you can see that the principles are pretty universal, right? It's all about assessment, partnership, and using technique over force. So here's the question. What if we approached every physical interaction in our lives, not just in a clinical setting, with the same care and intention of this hidden choreography?